Welcome back, everybody. Today we're taking a deep dive into a topic that's all about being a detective.
Oh,
Yeah, we're going to be talking about angina and the art of clinical history taking.
interesting.
Yeah, it's super important for medical students especially
Right.
to be able to tell the difference between different types of angina, what each one could mean for the patient.
Yeah, you're absolutely right. It's so essential for proper management to have like a systematic approach when you're assessing chest pain.
Right.
You really got to be thorough and think critically
Yeah.
to make sure you get that diagnosis right.
Okay, so let's start with the basics. What exactly is angina?
Well, angina isn't actually a disease in itself.
Okay.
It's more of a symptom of something else, myocardial ischemia,
Okay.
which basically means the heart muscle isn't getting enough of that oxygen-rich blood.
Okay, so the heart's not getting what it needs.
Exactly.
And that leads to chest pain.
Exactly. Chest pain, that's like the hallmark symptom of angina.
Got it.
It's the heart's way of saying, hey, something's wrong.
Uh-huh.
You know, you can think about it like a temporary supply and demand issue,
Oh, okay.
where the heart muscle needs more of that oxygenated blood, especially when you're, working out or exerting yourself.
Right.
But if that supply can't keep up well, then you get chest pain.
So it's kind of like a traffic jam in the heart's blood vessels.
Yeah, you could think about it that way.
Okay. Now, our sources mention several different types of angina, though.
Right.
So what are like the key differences between them?
So let's start with stable angina.
Okay.
That's the most predictable type.
Okay.
Imagine you have someone who they experience chest pain when they're exerting themselves,
Okay.
like climbing stairs or walking really fast.
Uh-huh.
But it goes away when they rest or take nitroglycerin.
Nitroglycerin.
Yeah, it's a medication that helps to widen those blood vessels,
Okay.
improves blood flow to the heart. So with stable angina, you see this consistent pattern of chest pain with exertion, relief with rest or medication.
Right.
It's a chronic condition.
Yeah.
But it doesn't necessarily mean that a heart attack is like right around the corner.
Right. Okay.
Yeah.
Consistent and predictable.
Right.
But what about unstable angina? That sounds a little more serious.
Yeah, unstable angina is a lot more serious.
Okay.
This is when the chest pain is new, occurs at rest, or suddenly changes from the person's usual pattern.
Oh, wow.
Yeah, this is a huge red flag.
Right.
Requires immediate medical attention.
Right.
Could signal an impending heart attack.
So it's like crucial to recognize those warning signs.
For sure.
Now, our sources also mention two other types,
Right.
Prinzmetal's and microvascular angina. What sets those two apart?
Okay, so Prinzmetal's, also known as variant angina,
Okay.
is caused by spasms in the coronary arteries.
Okay.
You know those major blood vessels that supply the heart?
Right.
Imagine those arteries just suddenly squeezing shut, which can lead to some really intense chest pain.
So the pain comes from the artery itself constricting,
Yes.
not just a blockage.
Precisely. And this can happen even when someone's at rest.
Wow.
Sometimes even waking them up at night.
Oh, gosh.
And it's not necessarily linked to physical activity.
That's fascinating.
Yeah,
Definitely different from stable angina.
for sure.
So what about microvascular angina? I heard that's more common in women.
You're right. Microvascular angina does predominantly affect women, and it's a bit more complex.
Okay.
The problem lies in the tiny blood vessels of the heart, not the larger coronary arteries.
Okay.
So you might not see any significant blockages in those main arteries,
Uh-huh.
but those smaller vessels aren't working properly,
Got it.
leading to reduced blood flow and chest pain.
So it's like a blockage in the side streets rather than the main highway.
Yeah, you could think about it that way.
But the heart still suffers the consequences. So how do doctors begin to untangle all this when a patient comes in with chest pain?
Well, the first step is obtaining a thorough history from the patient.
Right.
Like it's the foundation of the entire diagnostic process.
So it's more than just asking, are you having chest pain?
Much more. We need details, specific details about the nature of the pain itself.
Okay.
What does it feel like? Sharp stabbing, crushing, burning.
Right.
And then where exactly is it located?
Huh.
Does it radiate to other areas?
Yeah.
Like the jaw, arm, or back?
So they're really trying to paint a detailed picture of this pain.
Absolutely. We need to know how long the pain lasts when it started and what seems to trigger it.
Okay.
Is it brought on by exercise stress or even eating a big meal?
So they're looking for patterns and triggers.
Exactly. And
Sure.
we can't forget about any associated symptoms.
Right.
Like, is there shortness of breath, nausea, sweating, dizziness accompanying that chest pain?
Right.
All these details can help us differentiate between the different types of angina and other potential causes.
It sounds like detective work, piecing together all those clues to get to the bottom of the problem.
That's a great way to put it.
Yeah.
A good clinical history is like building a case,
Right.
each detail providing valuable evidence.
Right.
Yeah.
Okay, so we've talked about the different types of angina
Right?
and how taking a detailed history is really important to
Mm.
understand the patient's experience.
Yes.
But besides asking questions, what else do doctors actually do during the physical exam to assess chest pain?
Well, a thorough physical exam is another key part of the process.
Okay.
We're looking for any signs that might support or challenge our initial thoughts based on the patient's story.
Okay, what kind of signs specifically would you be looking for?
Well, we would start by listening to the heart and lungs with our stethoscope.
Okay.
Checking for any unusual heart sounds, like
Mhm.
murmurs or gallops, which could point to heart problems.
Okay.
We'd also listen for crackling sounds in the lungs,
Right.
which might indicate fluid buildup because of heart failure.
So even just those subtle sounds can tell you a lot about what's going on.
Absolutely. We'd also check their pulse and blood pressure,
Right.
looking for any irregularities or increases that could be contributing to the chest pain.
Okay, and what about physically examining the chest area itself?
Yeah, we'd also want to examine the chest wall for tenderness or swelling,
Okay.
which could indicate a musculoskeletal issue,
Okay.
like a strained muscle or costochondritis.
Costochondritis.
Yeah, that's inflammation of the cartilage that connects the ribs to the breastbone.
Okay, wow. So even something like just inflammation can actually mimic serious heart pain.
It can, and it's a good reminder that we really can't jump to conclusions.
Right.
We have to consider every possibility,
Yeah.
rule out other causes before saying that chest pain is definitely coming from the heart.
Right now, speaking of other causes, our sources mention that there are several non-cardiac conditions that can mimic angina.
Right.
So tell us a little bit more about those.
Okay, so one of the most common ones is gastroesophageal reflux disease, or GER.
GER, okay.
It's that burning sensation people get
Uh-huh.
when stomach acid flows back up into the esophagus.
Right, what we usually call heartburn.
Yeah, exactly,
I
heartburn,
think we've all had heartburn at some point in our lives.
probably.
But how can that be confused with angina?
Well, that burning sensation can sometimes radiate up to the chest
Uh-huh.
and feel really similar to angina.
Oh.
What makes it tricky is that sometimes GER can actually trigger spasms in the coronary arteries
Oh, wow.
in people who already have heart disease.
So it's not always a clear-cut case of one or the other.
Right.
They could both be contributing to the pain.
Exactly. The human body is complex.
Yeah.
Symptoms can overlap, makes
Yeah.
diagnosis kind of a challenging but
Yeah.
fascinating process.
Yeah, for sure. What are some other non-cardiac mimickers that doctors should be aware of?
Well, musculoskeletal problems are another big one.
Okay.
So imagine someone strains a muscle in their chest or rib cage,
Right.
maybe from a tough workout, or even just a persistent cough.
Wow.
That can cause pain
Yeah.
that really feels like it's from the heart.
It's like a pulled muscle, but it feels like a heart attack.
It can, and it's important to tell them apart. So during the exam, we would palpate the chest wall, feel for areas of tenderness that might suggest a musculoskeletal issue.
Okay, so I imagine anxiety can play a role in chest pain too, right?
Oh, absolutely. Anxiety can show up physically in all kinds of ways.
Yeah.
And chest pain is a common one.
Okay.
When you're anxious, your heart rate and breathing speed up, your muscles tense up.
Yeah.
All that can lead to chest discomfort.
It's easy to see how someone feeling that would think, oh my gosh, something's wrong with my heart.
Right. And in some cases, that anxiety-induced chest pain can even trigger a full-blown panic attack,
Oh, wow.
which makes it even worse.
So it's a vicious cycle, anxiety, chest pain, more anxiety. So with all these potential causes, how do doctors tell the difference between true angina and these other things that look like it?
That's where our detective skills really come in.
Okay.
We have to look at all the information we've gathered from your history, the physical exam, the risk factor assessment,
Right.
and make an informed decision.
So it's not a single test or anything that gives you the answer. It's more of like a holistic approach.
Precisely, we look at the whole picture.
Right.
For example, if someone tells us they have a burning sensation that gets worse after eating,
Uh-huh.
and it's better with antacids, well, that sounds more like GERD,
Right.
not a heart problem.
Right.
On the other hand, if someone has this crushing chest pain that goes to their jaw and left arm,
Okay.
it's triggered by exertion,
Yeah.
they're short of breath sweating,
Right.
that's way more concerning.
Yeah.
Needs immediate attention to
Yeah.
rule out cardiac ischemia.
It sounds like experience and pattern recognition are really important here.
Oh, they definitely are. Yeah.
The more patients you see, the more cases you encounter,
Mm-hmm.
the better you get at recognizing the subtle clues and patterns that
Yeah.
can guide you.
Yeah.
But it's also about being humble,
Right.
recognizing that we don't always get it right
Yeah,
on the first try.
for sure. So what happens when things aren't clear-cut?
Well, that's when we might recommend additional tests to rule out certain things or to confirm our suspicions.
What kind of tests are we talking about?
Well, it depends on what we suspect is causing the problem.
Okay.
An electrocardiogram, or ECG,
Right.
can help us assess the heart's electrical activity,
Okay.
detect abnormalities that suggest a heart attack
Right.
or other heart problems.
Mm-hmm.
Blood tests can look for markers of inflammation or heart damage.
Okay.
And sometimes we might order imaging studies,
Okay.
like a chest x-ray, a CT scan, or an MRI,
Right.
to get a better look at the heart
Uh-huh.
and the surrounding structures.
So these tests give you a deeper level of insight.
That can either confirm or refute
Right.
what you initially thought
For sure.
based on the clinical presentation.
Exactly. And if we need to, we might even send the patient to a specialist,
Okay.
like a cardiologist or a gastroenterologist,
Right.
for further evaluation and management.
This whole process is fascinating.
It is.
It's like putting together a really complex puzzle, using every tool you have
Uh-huh.
to get to the right diagnosis and give the best possible care to the patient.
I couldn't agree more.
Yeah.
It's challenging,
Yeah.
but a super rewarding field.
Right.
And every case is different.
So we've talked about the different types of angina, the importance of that detailed history and physical exam, and even those tricky non-cardiac conditions that can kind of complicate things.
Right.
But let's talk about risk factors now.
Okay.
Why are they so important when you're evaluating a patient with chest pain?
Well, risk factors are kind of like puzzle pieces that help us figure out how likely it is that someone's chest pain is related to their heart. You can think of it this way.
Yeah.
If someone has a bunch of risk factors for heart disease,
Right.
their chest pain is statistically more likely to be coming from their heart.
Got it.
We have to consider those factors along with everything else we've learned about the patient.
So it's like a warning system.
Exactly.
The more risk factors you have,
Right.
the higher the chances of heart trouble.
Exactly. For example, let's say someone has a history of smoking, high blood pressure, diabetes,
Okay.
and they come in with chest pain.
Uh-huh.
We'd be much more worried about a heart problem
Right.
than if it was a young, healthy person with no medical history.
Makes sense. It's all about weighing those probabilities
Yes.
based on the individual's risk profile.
Right.
So what are some of the key risk factors that doctors consider when they're evaluating someone for possible angina?
Well, we've already mentioned a few of them.
Right.
High blood pressure or hypertension is a big one.
Okay.
It puts strain on the heart and blood vessels,
Right.
making them more prone to damage over time.
Yeah. And we know diabetes is a major risk factor for heart disease, too.
Definitely high blood sugar can actually damage the lining of the blood vessels.
wow.
Makes them more likely to get blocked.
Uh-huh.
And then, of course, there's smoking.
Right.
A major culprit.
Yeah.
Damages blood vessels, increases blood pressure, reduces how much oxygen gets to the heart.
Yeah.
One of the most modifiable risk factors.
Right.
Quitting smoking can significantly improve heart health.
What about cholesterol?
Yes,
I know high cholesterol is often connected to heart problems.
you're right. High levels of LDL cholesterol, that bad cholesterol, can build up in the arteries, forms plaque,
Yeah.
which narrows and hardens the blood vessels.
Right.
This process, atherosclerosis,
Atherosclerosis, right.
restricts blood flow,
Yeah.
increases the risk of heart attack and stroke.
So it's like the cholesterol is clogging up the pipes of the heart,
That's a great analogy.
making it harder for blood to get through.
Exactly.
Okay, and then there's family history.
Right. If someone has a family history of heart disease,
Uh-huh.
especially if their parents or siblings had heart problems at a young age,
Right.
their own risk goes way up.
So genetics plays a role, too.
Absolutely. Some people are just genetically predisposed.
Yeah.
Even if they're super healthy,
Right.
they may still be at increased risk.
Right.
That's why it's so important to know your family history.
Yeah.
Talk about it with your doctor.
This is all really helpful information, but how do doctors actually use this risk factor stuff to help them make decisions?
Well, first of all, it helps us figure out how urgent the situation is.
Okay.
You know, if someone with lots of risk factors comes in with chest pain,
Right.
that's a big red flag.
Yeah.
We need to evaluate them quickly,
Right.
rule out a serious problem.
So it's kind of like a triage system.
Exactly.
The more risk factor,
Right.
the higher the priority.
Exactly. Risk factors also affect what tests we might order.
Okay.
For a high-risk person,
Uh-huh.
we might do more aggressive testing,
Yeah.
like a stress test or an angiogram
Right.
to check for blockages.
And on the other hand,
Right.
if someone has very few risk factors
Mm-hmm.
and their chest pain is clearly from something else, like
Right.
GERD or a muscle strain,
Exactly.
they might not need any more tests.
It's all about individualizing
Right.
based on the patient and their risk factors.
Okay, this has been super insightful.
Good.
It really highlights how important it is for doctors to be thorough.
Yes.
Take that personalized approach when they're evaluating chest pain.
Uh-huh.
It's not just asking a few questions
Right.
or ordering one test.
Exactly.
It's about looking at all the pieces.
Yes.
Their history, the exam, their risk factors,
For sure.
to get to the right diagnosis
Uh-huh.
and come up with the best treatment plan.
Absolutely.
And to all of our listeners out there,
Yes.
be proactive about your heart health.
Right.
Know your risk factors, make healthy choices,
Yes.
and work with your doctor to manage any underlying conditions you have.
Couldn't agree more. Knowledge is power.
Yeah.
And when it comes to your heart, that knowledge can save your life.
Such a great point to end on.
Thank you.
We hope you found this deep dive into angina and clinical history taking informative and helpful. Remember, every detail matters when it comes to your health.
Yes.
Until next time, stay curious and keep those brains buzzing.